Hi, my name is Victoria Hall, and I'm a rising junior at Bucknell University majoring in biology. Today we'll be talking to you about the effects of subthalamic nucleus deep brain stimulation on levodopa and dyskinesia reduction in Parkinson's disease patients. Parkinson's disease, or PD, is a neurodegenerative disorder caused by the death of dopamine-releasing cells. Levodopa is a precursor for dopamine and is used as a drug for PD to alleviate symptoms. Dyskinesia is a common side effect of levodopa and is defined as involuntary and uncontrollable movements. When levodopa-induced side effects become worse than PD symptoms, deep brain stimulation, or DBS, is a surgical option. DBS is implantation of electrodes into the brain to deliver electrical impulses to specific regions. For PD, a common target is a subthalamic nucleus. To quantify the amount of tissue in the brain that is stimulated from DBS, volume of tissue activation modeling is used. DBS reduces both levodopa and dyskinesia, but it is still unknown if their stimulation locations overlap for optimal reduction. Therefore, the objective of the study was to determine the optimal stimulation location for the greatest reduction in levodopa and dyskinesia. For this study, 40 patients underwent bilateral SDN-DBS, and their VTAs were calculated using patient-specific electrical volume conductor models. The amount of activation in the dorsal, ventral, medial, lateral, and anterior-posterior directions were calculated in and outside of the SDN, as shown in Figure 1. Levodopa equivalent daily dose, or LED, and dyskinesia scores were taken at pre- and post-operative assessments. As for findings, levodopa and dyskinesia both significantly decreased from off-stim to on-stim, as shown in Figure 2. However, levodopa and dyskinesia reduction were not found to correlate with one another. Thus, stimulation may play a direct role in the reduction of dyskinesia as opposed to indirectly through levodopa reduction. Figure 3 shows significant relationships between activation location and levodopa and dyskinesia reduction. Dorsal SCN and posterior external activations were found to correlate with levodopa reduction. Ventral external activation and active contact position Z were found to correlate with dyskinesia reduction. Figure 4 compares high responders who have greater than 70% reduction to responders based on activation. For levodopa, the anterior, dorsal, and lateral directions were found to be significantly greater for high responders. In contrast, for dyskinesia reduction, dorsal external activation was greater for high responders. Overall, stimulation above the SCN may play a role in dyskinesia reduction. This may be due to the stimulation of the pallidothalamic fibers, specifically the lentricular follicus, which originates from the globus pallidus internus, given in Figure 5. Stimulating these fibers may be comparable to stimulating the GPI itself, an alternative target for PD, to yield the same results of dyskinesia reduction. To conclude, the optimal stimulation location for levodopa reduction appears to be within the SCN, whereas the dyskinesia reduction, it appears to be above the SCN. Thank you.